Hello, my name is Carson. I'm going to be your student nurse today. So I'm going to go ahead and give us some privacy and close our curtain. I'm going to wash my hands. Can you give me your name and age, please?
Donald Howard, 45.
Thank you. So today I'm going to be changing your wound dressing, and I'm going to remove it and put on a clean one for you. So I'm going to go ahead and start getting our supplies ready. I'm going to grab my surgical sponges and set this off to the side, as well as my saline solution pen. I'm going to put this here. So I'm going to palm the label of my saline solution and lip it. Okay, and then I'm going to pour a little bit into my sponge. And if I were to set the cap down, I would set it up so the bottom is not touching the table and it would still be sterile. So now I'm going to apply my towel drape, and I'm going to open it and grab in the 1-inch border, not letting this touch anything. Try not to shake it and do not reach over it. Okay, so now I'm going to grab the rest of my supplies and plop them into the towel without hitting the 1-inch border. So open this, going to plop these down. I'm going to grab my Q-tips and I'm going to open them and plop them down. Okay. Throw that away. Going to grab my my abdominal pad. Plop that down within the 1-inch border. So my patient has an abdominal wound, so I would make sure that he is sitting in an appropriate position for me to give him care. So he's going to be in his supine position while I give the care to him. And I'm going to expose his wound. So now I'm going to remove the dressing, and this is not a sterile procedure at the moment, so I'm going to put on my non-sterile gloves. When removing the wound, you would remove it layer by layer, and note any discharge, coca, any exudate or tunneling. So I'm going to remove the first layer. There's no discharge on the top layer at the moment, so I'm going to throw this into my trash can as well. Okay, now I'm going to remove the second layer. And I'm going to look at the discharge. Note the color, the odor, the consistency, and the amount of any discharge. So I'm going to throw that in my trash as well. And then I'm going to start pulling this out again, layer by layer. Okay, and I'm going to throw this away as well. So now again, I'm going to be looking inside the wound for tunneling and any undermining. And I will note that. So now I'm going to quickly grab one of these, try not to touch the towel, and I'm going to measure this. So I would measure the width and the length, and I would measure it next to my ruler or my wound measurement guide. So put that away. Now I'm going to be putting on my sterile gloves and repackage the wound. So I'm going to open this up. Okay, so I'm going to open this up, take out the package. Now that I have my sterile gloves on, I'm going to repackage the wound. So I'm going to start by taking my 4x4 gauze and I'm going to wring it out. And I'm going to pouch it. And I'm going to clean this side and throw it away. Now I'm going to do the same thing. Again, wring it out, pocket it, and clean the other side, and throw it away. Now with the last one, I'm going to take it, wring it out, and I'm going to fluff it. Now I'm going to grab my other utensil and I'm going to use this to poke it into the wound. And make sure if there's any tunneling or undermining that I make sure that this goes into all those areas because we don't want an abscess to occur. And if we need more than one, we would use more than one. So now I'm going to throw this away as well. So now I'm going to take my 4x4 pad and use as many as I need, and I would cover the area. Use 1 or 2, I'm going to go ahead and just use 2. Make sure the full area is covered. I'm going to grab my abdominal pad, knowing that the blue side goes up. And now I'm going to grab my pieces of tape, and I'm going to put them on in a window fashion. And this is not sterile anymore because it is now covered, so it is okay for me to grab the tape. That would not be on the sterile field. And ideally this tape would stay down, but it's not sticking to my stuffed animal's fur. So then the last piece of tape I would put across, and I would put my initials and my name. Or not my name, the date and the time. So after this is done, I would document the measurements that I took on the wound, the COCA, so the color, odor, consistency, and amount. I would note any slough, any tunneling or undermining. I would note the surrounding tissue. I would note any exudate, erythema, and make sure that when I was giving care, how the patient tolerated it. And then after I'm done, I'm going to make sure that I take off my gloves and wash my hands. Thank you.